Hello, welcome to my Pharmacist series of video broadcasts aimed at educating you about the duties of the pharmacist to the patient. This video broadcast is brought to you courtesy of a young upcoming pharmacist at the University of Benin City, Edo State. As you can see, that is a photograph there. It's a gentleman, easygoing person. His voice is the one you're actually hearing right now. You can hear right now. Right now. To start with, I'd like to talk very briefly about the healthcare practitioner. Uh, we all do not pray to falsely, but when it happens, we actually need a rational and expedient, proper cure to restore us back to our feet, to be economically and morally viable in the society. And this healthcare, proper healthcare is brought to us by a team of a group of people called a healthcare practitioner. So essentially, the healthcare practitioner, or in another way, the healthcare team, is made up of physician, the nurse, and the other caregivers, the pharmacist, the laboratory scientists, and others. But our major focus today is the pharmacist. Now, why are we so much interested in the pharmacist? We are interested in the pharmacist because, according to research has shown that nearly 85% of the cases of illness require drug for treatment, and the pharmacy is the last point of contact in the healthcare system. Talking about the hospital or generally community pharmacy, it really doesn't matter. What matters most here is that more and more patients keep coming to the pharmacy outside the hospital setting or whichever setting. These are some of the predominant diseases that have been effectively managed with drug therapy. For now, there are no other therapies for these diseases except for medications. And the pharmacist and the patient. Now, this is a thing of interest because um, the way the pharmacist is being viewed by the patient is entirely different from the role he performs. Now, technically speaking, the public view the pharmacist as an expert in the drug product, and the disease for which these drugs are used. Now, the drug is not completely the same as the drug product. Now, the drug is that active constituent of any medicine taken to relieve a particular disease condition. The active component, while the drug product is made up of the drug as well as some other constituents that have been added to the drug in order for it to be suitable for a particular route of administration. Now, uh, the definition above is partially true because these roles are managed effectively by the pharmacist. But more encompassing is the role of the pharmacist in the health sector. Now, the definition above doesn't really capture the role of the pharmacist in the health sector. So, pharmacists offer care, formerly known as pharmaceutical care, and this is not completely new, although it's new to the public. But we're going to be talking about it right now. Now, pharmaceutical care entails making sure that drug therapy is tailored toward a desired outcome and properly monitored. Now, we don't want to just give drug to the patient and allow the patient to go just like that. We want to make sure that these drugs are effectively used to help the patient get Well, now, what does the pharmacist do effectively under pharmaceutical care? The pharmacist dispenses your medication to you as prescribed by a physician, or if it's OTC drugs, they are given to you on your demand. But of course, more than that, he also counsels you on the best way to use this medication, and he listens to your complaints about the medications. So if you have any complaint about whether you cannot take a particular drug, whether you like it in capsule or in any form, he listens to your complaint. He also educates you about your disease condition. There are certain assumptions that some disease conditions that have not been documented in literature to have been cured. Certain people have assumed that these medications can cure this. It is not true. It is through the pharmacist that you'll be able to know that these medications only help you to manage these drugs. They only help you to manage this condition, but not to cure it. But as far as we know now, we don't have cure for diabetes. We don't have cure for hypertension. But this can be effectively managed as long as possible. And he also monitors your drug therapy. So because he is the person directly in charge of drug, he knows what to look out for. So that's the essential role of the pharmacist. Now, as a patient, you are an important part of the healthcare system. Why? Because your decision is crucial to your well-being. Psychologically, it has been found out that patients should be given a right to choose what to use and what not to use, but of course, with the guidance of the professionals. So, when next you visit the healthcare system, don't put pressure on the pharmacist. Endeavor to be patient with your pharmacist to help you utilize your drug therapy effectively. Now, how do you express this patience? First and foremost, although very unimportant, but is to show that you accept the welcoming greeting of the pharmacist. This way is very relaxed and at home to answer your queries. Endeavor also to answer questions with great fidelity. Fidelity is essential in health treatment because pharmacists, doctors, and nurses are not magicians. They work with what you tell them. So, exactly how it happens, let it be known to the pharmacist in that way. Also, providing vital information as required. So, when you are asked, endeavor to provide the information. Essentially, you also need to ask questions about your medication as well as your medical conditions. We know that some persons, some patients, takes drugs but do not know what these drugs are for. That is why your pharmacist is there for you. Ask any question about your medication as well as your medical condition. You should be able to provide essentially quick answers to your questions. Listen to the directive of your pharmacist. In order for you to enjoy the maximum effect from your drug therapy, you need to adhere to the instruction of your pharmacist because he knows what exactly should be in your blood system at a particular time. Report suspected issues with your medications to your pharmacist. Patient should be very patient. Why? The ideal patient should do it is essential for two basic important things because you are a patient. Now, when you enter into an ideal hospital setting, the first thing you see is patient should be patient because if you are not patient, you won't be able to obtain maximum benefit from your drug therapy. So you have to be patient, and the only way to show that you are patient is to wait for your turn. The pharmacist is there for you for two basic reasons. First, to provide you with your medication and to help you maximize and to help you make maximum benefit of it. So be patient. Thank you for watching this episode. See you next week. Goodbye. Don't forget to subscribe to my channel and please share the links with your friends and family because we are out there to educate you about what your pharmacist should do for you, what you should do for your pharmacist. Thank you.